Welcome to the Your Family Dog podcast, where we celebrate the special bond between families and their canine companions. Our goal is to help families and dogs grow up together, one episode at a time. Welcome to the Your Family Dog podcast. And today I'm joined by Leigh Mack, and he's going to talk to us about motor vehicle collisions and why a veterinarian might need to be called to a scene, all things dogs and motor vehicle collisions, and maybe get even into horses a bit. So, Leigh, I'll let you take it away and talk about your program.
Okay, my name is Leigh Mack. By education and training, I'm an MD, PhD. I did went back to medical school midlife. It's kind of a midlife crisis. Ended up doing postgrads in England and was at John Radcliffe and trained in trauma plastic surgery. Did a PhD in nanotechnology for medicine. Uh, Came back, became a principal investigator, certified principal investigator, boarded in clinical research. Did over the years worked with a lot of medical devices, some hydrogels for wound care, etc. Still enjoy that. Still actually looking at starting a new project in a couple months with another company that's kind of related to trauma. And anyway, so years ago, I was infantry and cavalry, National Guard. Missed wearing a uniform, missed the missions and the camaraderie and that kind of thing. So I joined the Tennessee State Guard and was the S3 operations staff officer for the medical battalion. And we became the cadre for trauma combat casualty care. We trained everybody, through level 2 to 4 before they went on deployments. Moved to South Carolina, transferred over to South Carolina State Guard, and ended up being civil affairs officer on general staff. And that role was our main mission was disaster response. So a few hours after disaster, a couple days after, when the FEMA and regular National Guard would take over, etc. And I was charged with developing new relationships with volunteer organizations, community organizations, and basically getting them to a point of them working with us and training with us for natural disasters. So did that for 2 years. Great job, great bosses, great two-star to work with. Moved back to Iowa, take care of elderly parents, found myself missing wearing a uniform, so decided to go up to the local fire department and say, yeah, here I am. I went through fast course for EMT, so I'm also a licensed EMT. Firefighter 1, just got done with firefighter 2. Really kind of interesting. It's a different tip of the spear compared to combat arms, but
Right.
started putting stuff
And thank you
together.
so much for your service. Like, what a testimony to just a life of service.
Yeah, been a scout leader through all different levels from national down to unit level 2, but I won't get into that. So yeah, enjoyed that. Had some calls that I wasn't even on. One particular where they had the rescue dog out of the ice, called mutual aid, had the ice rescue team come out, and the dog had been in for over 20 minutes. Dog survived and everything, but had this kind of like, geez, it would have been nice to have a vet that we could have just called out and came out and kind of evaluated the dog right after the event, or right after the event. And then I started thinking, I'm like, there's one or two calls where you had to put bunker gear on for medical calls because they had a dog that was kind of a little bit protective of the owner, if you know what I mean. And I started
Yes.
thinking about it. Yeah. And I started thinking about it more this past winter. And I said, I wonder, is there anybody that has vets, available or part of the CAD 911 system? And in my research, found BART and SARTs that were popular 12, 15 years ago. Talked to a retired vet for the Iowa Veterinary Medical Association. He said, yeah, we had something like this. It was kind of there, but it wasn't really entrenched. I was like, okay. So I had this idea, started the company, started non-for-profit, kind of put up a website. It started statewide, and I thought maybe I should go nationwide. But I went up to the Iowa Veterinary Medical Association's annual meeting and bounced it off a lot of vets. The dean of the school of veterinary medicine for Iowa State thought it was a good idea. The new president thought it was. A lot of vets thought it was. And, my research, nobody really does this except for a few pockets. UC Davis has one that they do. Florida, UF has one. There's a few others, and it's usually surrounded around veterinary schools. But there's really, in the amount of stuff that you have to do now as a first responder on the fire EMT side, most of our firefighting force is volunteer. It's over 70%, and the rest is career. So you're asking a volunteer, okay, we need you to do, 200 hours of FF1. We need you to be an EMT, maybe a paramedic if you're so motivated. And then we need you to go to FF2 eventually. And so, I know, answer calls too. So it's a lot.
Right.
And then they just don't have the band. And we have hazmat too now. We have a big component is hazmat. So, to add on, oh, yeah, then we have veterinary medicine. It's just not there.
Right. Like I mean, it's too much of an ask. But
It's
I
too much.
imagine, I mean, obviously I'm not a first responder, but I would imagine that there are often animals involved
Yeah.
in motor vehicle collisions, in assorted um, crisis situations, whether
Right,
it's
right. And
somebody
and the
cuts off a
numbers,
horse trailer, which sadly I have seen happen. Um, it does not end well, right? Or a dog traveling in an RV with its family, or a dog in the car. So I love the idea. I was telling Lee before we hit record that I recently started wondering and asking law enforcement when I see them, because I will talk to a toadstool, um, what their preference is if they, for example, pull someone over and there's a dog with big feelings in the car. Like, how would they like the average civilian to handle that situation? And it took them a minute to decide. Like, even no, not my dog's riding crates, right? So it's not an issue for us. But in the past, when I had dogs who were free in the car, handing a driver's license out to someone, that dog may have taken an affront to. Like, why are you coming so close to my mom? So, so
yeah.
what made you think like, oh, well, we could have a team of vets who maybe wanted
So
this?
so so I did a lot of research, being the researcher guy I am, and backed into some numbers. So we don't have any national numbers. Like in first
Right.
response, the national reporting in different reporting agencies, they just don't have the numbers. So I backed into some numbers, and I kind of rounded down by 20% and came up with about 210,000 incidents across the US per year. Most of those being dog, maybe sometimes cat in a vehicle, motor vehicle collision, right? And that could be also a semi or RV too. So the other parts were like 7, 8,000 in structure fires, and about 8 to 9,000 of large animals will combine, uh, food animals, cattle, pigs, and horses all into one, for motor vehicles mainly. Some barn structure fires, some facility structure fires, that you have
And
animals
a lot of
in.
times those are lightning, aren't they?
I don't even want to speculate. I mean, you can have a bunch of stuff on like, commercial fire start and that kind of thing. But you kind of think of the pinnacle of care. So, in a perfect world, we'd have emergency physicians on advanced ambulances, and they could
Oh,
just
of
go out
course.
and do
Right.
like,
But
this full on intervention right on scene in the back of this mobile, ER, right? Trauma bay. So trauma bay on wheels, basically. Well, we don't have that.
right.
But you look at it from a vet standpoint, it's like they can go out and practice a little bit, in the field as opposed to human doctors. So I looked at it and thought, well, if I could bring vets that, are licensed, trained, you're not going to get any better, right? And then we can slice those into a volunteer fire department. And right now we have the doctrine, guidelines, rules, whatever you want to call it, for both FEMA and NFPA. So NFPA are national, U.S. national guidelines for firefighting. That's from anything from gloves to fire trucks to positions, within a fire department. And they have a thing called a special medical category. And it's basically they're not an EMT, they're not a firefighter, and it was written, I believe, for human doctors to be able to go and kind of fit into this. But it doesn't say that. It just says, special medical responder. And so the vets fit perfectly into the NFPA for special medical responder. And so the guidelines are kind of set, so we don't have to create that. So on approaching some different, captains, battalion chiefs, main fire chiefs, they call them CFOs. They'll either kind of go, huh, or they'll go, oh yeah, I could have used that on A, B, C, D calls, and they're already thinking of past calls that would have been handy. And so that's kind of, and historically we've had probably 15 different organizations that have done, including AVMA, that have done disaster vet, teams, right? But they're not part of the CAD system. They're not part of the 911. They're not already built in and baked in. So I'm looking at it from a standpoint. You go to volunteer fire department, you got 30 firefighters, 15 EMTs of that. And you go, oh, by the way, we got this, we got 7 or 8 small animal vets in the county, and 2 are in your area, and they'd like to join as special medical. And they kind of go, well, within FRVN, we promote doing ICS. There's 4 FEMA courses, 100, 200, 700, 800. So that gives them the knowledge to understand what incident command is and how
Right.
incidents are run, what's a hot zone, yellow or green zones, where they fit in, who to talk to, where to go on scene. And so they're situationally aware. They kind of know how things flow. Once we get them involved with a fire department, they can kind of follow their SOPs. They can kind of train with them, to whatever level they want. If they want to become, hey, I want to put on the bunker gear and do everything and go that far into it, be a firefighter also, they can. Or they can come back here and go, oh, this is how you guys do vehicle extrication. Okay, now where do I come in? And they go into their piece, right?
Right.
So that's the concept of it in a nutshell. And the idea is to have at a county level, because that's what most 911 systems are, that you have 7 or 8, small animal vets, a couple large animal vets that are available. And because a lot of volunteer forces are mutual aid career departments, the career departments will watch these volunteers do this for, maybe a year. And they'll all of a sudden get in a situation and kind of go, huh, maybe we should try using the vet on this. So they call 911, hey, can you dispatch a vet?
Well, and
So,
I think we've all seen video on our local news of a firefighter giving a dog or a cat oxygen coming out of a fire, trying to save them. Um, my paternal grandparents had a house fire, and sadly, some firemen were injured. My grandfather died later as a result of the house fire, but they had a dog, and the firefighters tried to save Teddy and couldn't. And our family was incredibly grateful that these men and women put themselves at risk to try to help our family and even our family pet.
mhm,
Um,
mhm.
I think it's obviously, I think the emphasis is on saving humans, but
Right.
I appreciated that they realized that the whole family encompasses the dog too, or the cat too, or the bird or
Yeah.
whatever.
Yeah. And there's a retired vet. I won't name him. But we were talking the other day on the phone. He's gonna be on a call with me this weekend. And he said, I've watched my career the dogs go from the backyards or, the farm into the house and now from inside the house and living room now into the bedroom. And he, obviously he means that, dogs are becoming more and more a part of people's family life. And there's
Yes.
about 80 million households that have dogs. It's like dog or cat. I think it's like 65% or 70% of the households have these in the US. So it's a big number that people
Well, and
have.
it makes me think I don't have one of those things on the house that says, hey, there's two adults, there's three dogs and a cat, right? And I really should have that on the house somewhere so that, God forbid, we have a fire, the fire department is aware of the situation.
Hmm. Hmm.
I had that in
And
previous homes. I just haven't done it recently.
yeah, you kind of have to almost, I'd almost put it on my mailbox stand now, know what I know. Because if you have it on something and you're going in the house, you're not looking for that. But as you roll up, we call it a windshield size up, and you're looking for the address, right? Your GPS shows that you're looking for the address, and you see below the mailbox, you got a big old, five people and three dogs live here. And oh wait, okay, well that makes my life a little bit easier. Maybe they have other people visiting, we don't know, or maybe these people are at
Right.
work, but at least you kind of on your initial size up, you can do that because by the time you get to the door and you're deciding to go in, if it's not fully involved, you're doing 1,500 square foot home in 2 minutes. So you're
Right.
going fast because you're looking for victims,
Of
and
course.
so it goes fast, and you're trying to breach a door with a Halligan or something like that. So yeah, we have given that a little thought, but yeah, the idea is to have the volunteer vets have a jump bag, and so FRVN is we're got the kit without the drugs, and that's kind of the biggest lift of what we're trying to do is we're trying to get all the supplies out where they can just put it in their vehicle and go. And we got coveralls that are flame resistant. We got bump helmets. That's all part of the kit. So they do show up on scene with the right gear, the appropriate safety PPE for most department SOPs, so on and so forth. So the idea is the vet hangs back with just like the paramedics and EMTs and ambulance. The firefighter would bring the animal out, say, here you go. But if you think about this, if you got, let's say, a motor vehicle accident or, a structure fire, and we're getting a lot more information on our 911 systems now. We're getting people information about their medical condition. It's really getting detailed. And if I get a call as responding captain or something, I see hey they're saying they got four people in the house and two dogs. And you're like, okay, like you know, hey dispatch, can you send the vet? And then they page one of the eight vets goes, yeah, I'll respond, and it respond on scene. Now it instantly gives that captain the vets 10 to 12 minutes out. They're gonna roll up on scene. So I
Well, and it
know I know
also
to look for
gives
them.
the captain, the staff that would be caring for those animals or
Yeah,
who are conflicted because they're like, I have things I need to do, but I also like we
right,
all love animals and house fire isn't the dog or cat's fault, hopefully. Um, that that those staff people, those firefighters are going to be available to
right,
fight a fire and
right,
to help with other things too. That it's gonna the vet's gonna provide extra support.
right.
I think that's
Exactly.
amazing.
And a lot of times,
And I
if you
wonder
think
how
about,
many retired vets would be like, yes, this is something I can
I
do.
don't, we're getting a few, we're getting a few. But yeah, you think about it from incident commander, right? That's what they call that. That's in charge of the incident. You go, okay, I got two human victims. I got, EMT paramedics on the ambulance, they're doing them. And, the firefighter drug out two dogs, and my vet's just rolling up, and I just go, hey, boom, right there. Now I don't have to worry about those dogs, right? Now I can have all my firefighters focus on defensive engagement of the structure and work on, where we bringing water from, all that stuff, because that's a logistical thing that's pretty intense in itself. And so now you can focus 100% of your fire department on the fire and, medics taking care of both human and canine. And,
Or
and then let's say
feline.
you get,
We're not going to forget about our silly kitty friends.
yeah,
We are equal opportunity here.
right, but let's say the evening news comes out, right? So now you got the county person that's been elected, and they're watching this, And, all of a sudden they go, oh, they got these two dogs that are doing something. Who is this? Oh, it's actually a licensed vet in the state of. So now we got the highest level of care on the ground taking care of these animals. And if you think about it more
And I
from,
wonder if it can be opened up to like licensed vet techs to LVTs.
so we've talked about this, and the way we're doing that is they can't use the category 3, 4 drugs, obviously. So what we're telling the vets is if you
Because they
want,
can intubate. An LVT can, at least in Georgia, it's probably
yeah, it's
different in
different
every
all over.
state. But being able to intubate is kind of the big deal, right? To be able to intubate without a vet
Right.
watching and
So
supervising is kind of a big deal
yeah, so to that point is the way we're seeing the vet tech's role is the vet tech could roll with the
with
vet.
the vet
Yeah, so then
and be
there's no
another set of
question,
hands.
another set of hands, especially on large animal. If you're talking horse trailers,
Oh, yeah.
or cattle haulers or something like that, where you're going to need a
Right.
lot of hands. So then the vet becomes, obviously in charge of the vet techs and go, okay, I need you to do A, B, and C. So again, it goes back to incident command. You look at that and you're like, I got the experts, on the ground dealing with it. Guess what? I don't have to think about it now. I mean, I do, but I can focus on, people, fire, and hazmat now.
Right.
So and on the other side of it, people judging it all, on the nightly news, you can say, yeah, we had vets on the ground taking care of these animals, and people are going to go, oh, you know, and so and the other component of this is depending on the state and how the fire SOPs are set up, the fire chief can give them the ability because they're part of the department to get blue lights or blue white lights or whatever that is, so they can come hot to the scene just like a normal typical responder for that department. So that seems to be a big deal because I hear a lot of stories about vets trying to get places and they can't for some of these, especially
Yes.
motor vehicle accidents.
So how often are you seeing
The
dogs or
call.
cats in motor vehicle accidents?
The number we came up with was about 210,000. I would say of that, for small animal motor vehicle collisions nationwide, you're probably looking at probably 170-ish, 170K
Wow.
nationwide. And if you next time you go to like a rest stop or a truck stop, watch how many truckers have a dog with them.
Oh, right. No, almost all of them.
It's getting bigger. And the RV, I never thought about the RV, and somebody brought it up to me. They go, "You should do the RV podcast." I'm like, "Oh yeah,
Yeah. RV. I mean, we almost always had a dog when we were in the RV. Almost
yeah."
always. I
And
mean, it's
I
one of the advantages of an RV is you can vacation and take your dog with you. And
yeah,
your bed is right there. So when you get tired, you can just pull in
yeah.
and go to bed. Um, I think this is an amazing idea. And I mean, I
We're the
hope
only
it
ones.
really
We're
rolls
the
out.
only ones. Yeah, we're the only ones doing it. But here, so AVMA approached me right after the AAHA article came out nationwide. And I was like, oh, okay, I wonder what this is going to be like. But actually, they said we got 400 vets trained in disaster response, and it's a certification they do and stuff. So I said, oh, he goes, we'd like you to, we'd like to link up and see how we could work together. And I started thinking about it, and as we're on the call, I said, after we get our network up and going, I said, they're already going to be part of, the response network. And I said, if you had a natural disaster, you think about it at Joint Operations Command for like a hurricane in South Carolina. So we have a JOC, is what we call it. And the JOC has all the different components: National Guard, the sheriffs, EMS for the state, EMS for the county, so on and so forth. But if they already knew that they had, let's say, 4 counties, 7 vets each, how can we
Right.
use them in this
That's a
situation?
big
What do we
deal.
need them for? What do we need?
Right.
Do we have livestock that's running around wild? And, do we
Right.
have, so that component
Do we have
is
injured livestock that need to
right.
be seen to or injured animals in general that need to be seen to?
Right, right. So it could be that our network becomes a network for disaster response, or if you think of wildfires out west, that could be another situation. We got four counties, we got these vets already in the system, they're already ICS trained. Maybe we rotate them in and out and just take care of all the branches we kind of come across where we have injuries. And so it could flex out to beyond just, okay, here's the incident, we're responding in 10 minutes, we're done in an hour and we're out. But it could be a network where
Right.
we use it
It
for
could be
long
responding
term.
to Katrina or responding to the
Yeah,
terrible tornadoes that just
right,
hit or the earthquake in Caracas, right? Or a
right.
tsunami. Like there's no end. And I do think as lay people, we're like somebody should do something. I actually know someone who he and his family personally went into New Orleans and kicked in doors and saved 20,000 animals.
Wow. And there's a lot of groups out there. There's like 15, but the
And a lot
sad
of those
thing,
animals did not want to be rescued. Thank you very much. I think
oh,
the one that he told me was the most challenging was the goose that was attacking him. That someone had a goose.
oh
But
my
a
gosh,
bunch of these animals were just locked in the house when people left, thinking that they were going to keep their animal safe. And again, when groups were going through to clear homes, they didn't have any like they don't know what to do with these dogs and cats. They're
right.
like, we don't know what to do with them. So yeah, he actually created a whole charity out of it. There's a statue for him. I will not name him because he doesn't like anybody to know. But like he and his team did, as we all were wringing our hands, all the civilians were wringing our hands going, somebody should go in there to help. He was actually doing it. And I'm proud to say that he's my friend and I love him. Um, so it's one of those things where he was like, there's no disaster relief for animals.
Yeah,
Like people wouldn't go to shelters because they couldn't take their animals with them or they would lose their animals. He actually came up with a system where they could hand off their animals and charity would pay for those animals to be housed for a certain amount of time
right.
to determine, are these people going to be able to take the animal back, or is it going to need to be placed in a new home, or does it need amazing medical care? Like a bunch of the animals that came out of
Right.
Katrina were heartworm positive and had
Oh
chemical
wow.
burns from the water and all sorts of things. And I mean, they vetted tons of animals. It was amazing. And it was really
Yeah,
amazing to see these lay people come together to say, this is a missed part of the population in this
right.
disaster that needs to be served, and we're going to help them. So, Katrina dogs were shipped, and cats and geese were shipped all over the United States
Right.
so that no one state or organization or city or shelter was overburdened.
Overrun.
Yeah.
Yeah,
And it was really smart program.
yeah, and on the backside of this, as we set a county up, right, we got the eight vets and they got their own practices and so forth. But we can have veterinary hospitals, if they don't want to respond, they can be part of the network. Meaning, for a couple $100 a year, we register them and we put, press releases out about it. But we go through and take, all the vet cell phones and information on what they can treat and so forth, and we give it to all the response. So all the volunteer fire departments, sheriff's departments, all that. So then at least they have like, oh yeah, let's put this in, and then at least we can call and have somebody take this animal over if the
Right.
vet can't come to us. And that's kind of handy for the police canines too and equine, because you got a whole network that could, of a few hospitals. And then secondly, you got more of the emergency 24/7s where
Right.
the responding vet can kind of make a judgment call. We have a consent process if the owner's, lucid, right, and able to consent. We also are going to come up with a program where animal owners can actually pay, we think it's going to be about $30-$40 a year, and don't suggest a donation, and basically register their house and their vehicles, so, and put a sticker on, so the vet can come back, see a sticker and go, oh, and then call our folks and say, hey, here's a plate number, here's a vehicle, and we go, oh yeah, they're pre-consented, they have pet insurance for $10,000. So now the vet knows, hey, I got some runway on this. They got
Right.
insurance
If
for
there's treatment
10,000.
required, it's already covered.
I can comfortably know I can take this back, do surgery on this dog. And then as part of that, we come up with a shelter network in that county. So if the dog just bumps and bruises, you do your full evaluations. Okay, dog's be fine. Person's in the hospital for 5, 6, 7 days. We can put them in the shelter,
Right.
and then as part of the run sheet and the CAD system, and this kind of gets into HIPAA, but because they know somebody that was on scene that's in a hospital, right? That becomes a HIPAA thing. But at least the vet and or the fire chief have a pathway to say, here's your animal, it's
Right. For
fine, it's
reunification.
at a shelter,
Right.
and communicate that to the owner.
So 1,000 years ago when I was young, I was asked by actually a local fire department. There had been a big house fire. The dog had been seen and treated for smoke inhalation. The It was an awful fire. Not everyone survived. It was questionable whether or not other people who had survived would survive long term. And so they asked if I could foster the dog kind of indefinitely.
Mm,
And I did until we could get answers on, is this dog going to go back home to someone or should the dog find a new home? And I did a lot of work on, like, this poor dog had terrible PTSD. So I did a lot of behavior work on,
right.
can we get back to kind of a place where we're not jumping out of our skin every time the thermostat on the stove satisfies, because this dog was so sound sensitive at the end. And
Oh, wow.
I've never been in a fire, thank God. I don't know how overwhelming that must be, but I can only assume that it's unbelievable. Um, so do you have tips for families? Not that we ever really want to need them, but for things that make disasters, whether it's a motor vehicle collision or whether it's some other disaster, that makes it more survivable or easier for first responders to take care of the family and the family pet?
Right. Well, I would say that, I'll leave that up to the veterinarians, but on the earlier call today, we were talking about that, and I said, "What do you think?" And this particular vet is in Panhandle, Florida, and she does large and small. And she said, I believe in the restraint systems, the harness, and the belt, and the carriers, and all that stuff. And I said, yeah. I said, really, the bad ones are the little dog that's sitting between the driver and the steering wheel. And
Yes.
if they hit and that airbag goes off, that dog's going to be part of their chest.
Yes. I have
It's
heard that from first
it's
responders that
really
it's,
bad. So I think like, again, I'll leave it up to the veterinarians; they're the expert. But definitely not in the front part of the vehicle. In the back is obviously better.
well, and
Um,
I will say, like, when we're training service animals, like service dogs, they're taught typically to ride in the passenger seat footwell, because that's viewed to be a relatively safe place for the dog to ride. But they need to be, for example, in the case of like a diabetic alert dog or a seizure alert dog, or even a psychiatric service animal, a dog who's supporting someone with high anxiety or
right,
panic attacks or PTSD or road rage, um, the dog has to be close to the handler, to their partner. So that's typically where we teach, because trying to crate or restrain the dog in the back seat doesn't allow them to do their job. And some of these jobs are 24/7.
right. Yeah, that makes sense. That makes sense. Yeah. So we're
But
just
yeah,
we're
not on
just
your lap, kids. Like you would
yeah,
not let
yeah,
your infant ride on your lap.
right,
Don't don't let your precious dog or cat ride on your lap.
right. Yeah. A lot of well, there's just not a lot of safety systems for, especially like horse trailers and everything else. It really
Oh
isn't.
yeah, no, it's awful.
Yeah, but So yeah, that's kind of the way we're doing it. We got 35 vets was our last count that are trying to tee up. I got three of them that are actually firefighters already. So we kind of
Oh,
already have the
wow.
model that I've inherited.
That's
And they,
really how
yeah,
interesting.
yeah, they're interesting. They're like, okay, can you just send me the SOPs and what you're thinking? I'm like, yeah. And so it's a lot of lift to do a nonprofit. I've done a lot of for-profit companies, and I've been on boards for rare disease, nationally for nonprofits and so on and so forth. But this is a big lift. So yeah, we need volunteers. I need social media volunteers. We need grant, we need we don't just need veterinarians and techs. We need other volunteers as
Right. We
part of
need
this.
everybody to jump in and help.
Yeah.
So,
So if
so
you got
on
owners that
that,
are interested.
as we're doing a call to action, how can people reach you and get involved in this
It's
in
really, yeah,
colossal effort?
it's really easy. It's called frvn.org. So frvn.org, and it's First Responders Vet Network.org, right? And the general email is info at. And on top of that, we have different pages for different people, pet owners, vets, all that stuff. We have contact forms on there, and we're going to bolster up our volunteer details a little bit more. Everybody can volunteer remote. We're not in any kind of hard schedule. So they can, do it at the beach, do it at 3 in the morning. A lot of this stuff isn't really super time sensitive, but we just need to help. And we got the vets, and we got the techs, and the fire departments and EMSs. It's a traditional industry, so
Yes,
just
they're a
like
little
anywhere, you
slow to
got different
change.
thoughts and opinions on different things. But I've had a buddy of mine's battalion chief, North Carolina. I said, "Hey, what do you think?" And he's like, he started listing off past events. He goes, "I'd love somebody on 911 system I could just page out and have them roll in."
No, I bet. I bet the average, yes. I mean, even just having animal control respond, right? Like,
Yeah, and that came
even
up.
that's a little bit of a help.
Yeah, but they're 8 to 5. You may get them. It's a
Yes.
city or county asset. They don't
Hmm.
have the ability. They're not doctors, right? They're not
Right.
veterinarians. You got a veterinarian, they got the whole kit. They can give the drugs, they can put the airway in. I got one vet that teaches others on how to trach dogs. That's not a typical skill you learn in vet school.
No.
It's so, they're I won't name her, but she's got a pretty cool job. But yeah, there's a lot of what we're gonna see come out of this is that we think we're gonna see in a couple of years some new guidelines and standards for veterinary clinical medicine as it relates to treatment at the scene, which really has never been documented too much.
Right. I wonder if there's actually a triangle of shelter vets with all of this, right? Because they're used to handling animals that might have big feelings about the situation they're in, right? Often
Right.
shelter vets are working with animals that are really in the middle of chaos and don't know what planet they landed on. And I actually have a really good friend who's a shelter vet here in Athens, where the University of Georgia Vet School is. So
Hmm.
I may mention this to her and see if it's something that, well, and she shows dogs, right? She breeds and
Yeah.
shows. So, she, I think pretty regularly, like on a showground, people are like, hey, she's a vet. Um, and then I also think like wildlife vets, even. And there are a lot of wildlife vets.
Yeah, that's an interesting thing. We haven't really addressed it or came up with it, and I don't want to, I always say
You
I don't
got
want to tell
enough
them
on your plate.
well, I don't want to tell them how to practice, right? But if you're a
Right.
vet and you're like, well, I deal with zoo animals, right? I knew a vet out in Reno, and she did big cats. And, she may be comfortable with, an elk that went through somebody's windshield that's in a ditch, and she can come out and say, yeah, I know how to take care of this. there may be 10 other vets that go, way outside my scope. I don't know
Right.
how to deal with that. So I think it's going to come down to, the level and comfort level. And, you're a volunteer, right? So, a lot of volunteer firefighters, you're not going to have everybody be an interior firefighter. It just
No,
isn't
I
going
mean,
to
I
happen.
know people who started as EMTs who
Yeah,
very quickly realized this was not the job for them.
right. Right,
That,
but they're gonna respond in their comfort level, and maybe
Mhm.
that'll expand, or maybe it'll just stay the same. And you're like, hey, I'm only doing small. I'm only doing A and B and C, and don't call me on deer through the windshield. But then there's others that are gonna go, yeah, I typically do small, but I'll take a swing at it. Nobody else is doing it, right? So they go out and make it happen. But yeah, I think that's really up to the practitioner. But I do think we're going to get some hopefully some data and feedback. We do have a run sheet where they chart what they did and all that stuff, so we can do some after action reviews on what went right, what went wrong. We got a quality section that we're developing where they can kind of go back and go, was this a good standard of care? Or is this something we want to start looking into? Or, okay, when this happens, this isn't working, you know?
right, like what can we improve upon?
Right,
Which
absolutely.
which I was listening to actually I was listening to a podcast that was firefighters the other day, and they were talking about that after run evaluation and that it's done every single time. And they're like, what did we do great? Where could we improve? Where do
Yep,
we want to maybe think about, like, okay, that it's just cumbersome and it doesn't work very well. So what could we, like, can
do
we
better.
brainstorm what could be done differently in this situation? Because every once in a while they get into a situation that they've never had before. Like there's not
Right,
really an SOP for this one. So,
right.
um, yeah, it was very interesting listening to them. And I'm one of those, I tell people all the time, I need 4 more lifetimes just to explore all the things I'm curious about. I love to learn new information. I love to learn about different facets of our communities and our lives. And so, like I said, I had just started thinking, like, in the past, I had dogs that if I had had a medical emergency in the car, there's no way that dog would have let someone in my car. Like, there's no
Right.
way.
Yeah.
And I wonder, like, okay, crud, does that put my dog in peril? Like, or are they going to
Good.
call animal control and it's slowing down my care?
Yeah.
So, because I work with lots of people as a trainer who have dogs with big feelings, I want to make sure I'm advocating for those dogs, for first responders, because none of us plan a car accident.
Right. Right. Right.
Right? Nobody plans to have this stuff happen. And, like, again, my dogs ride in crash tested military grade crates. That's what they
Wow.
ride in.
Your exception
Um
to the rule.
yes, and it was a big investment. Like I say all the time that if there is a tornado, I will be in one of those crates because they are that secure. Like me and a dog will be in the crate together, hiding in the house. So I, I made that big investment. I bought used, but I made that investment partially because I transport other people's animals too. And I had a trainer friend who someone she was involved in a motor vehicle accident that she did not cause, where her vehicle was rolled and
Yep.
they had to jaws of life her and the dog in the crate. They actually managed to, the crate came out as one big piece and the crate
Yeah.
protected the dog. And she said, when I spent the money on this crate, I thought to myself, this is ridiculous. What am I doing? Like, I could have bought a nice ring. And she's like, I am grateful every day that I
Yeah.
had that crate for the dog. So,
Yeah. And
um,
typically we're pulling people out of behind the B pillar, right? If it's head on, you're pulling them out, you're dropping the seat, pulling them out through the back windshield, through the back door. So if the dog's already there, as you pop that back door, you can just unclip the dog, pull it out of the way, lay the patient back, get them on the
oh, I didn't know that.
backboard.
I didn't know in motor
Yeah.
vehicle incidents, you're often taking the person out the back.
Yeah. Well, it's easier to pop the back
Right.
glass
Whatever is still mostly
instead of the
intact.
windshield. Yeah, yeah, and you can just drop the seat and slide them that way a lot of times. And that's not
Wow.
head on. Obviously, a rollover is just it just depends.
Oh yeah, this was a rollover and it was
Yeah,
awful. And to her credit, like her dog survived. As a matter of fact, the crate had scratches, but she sent it back to the company to be evaluated, and they
hmm.
did not have to replace it or repair anything. Like
Nice.
this crate took the brunt of, the car did its job and,
Right.
sandwiched up into a ball, but it, the structural integrity of the crate remained, and that kind of made me a believer. And
Yeah.
there are lots
Yeah.
of crating systems that are crash tested that you can look at for your pets. Um, and it's a, I don't know. I view it like I wouldn't let my kids ride in the car without a car seat or seat belts, depending on age
Right.
appropriateness. And so I don't really let the dogs ride loose. Not that I don't miss them. So,
Yeah.
Leigh, thank you so much
Yeah.
for
Thank
coming
you.
and talking about a subject that honestly I had no idea your organization existed. And I would love to share the word with veterinarians and with families. If you're a family member and this is something that speaks to your heart, talk to your vet. Contact it's
RVN. FRVN.org.
FRVN.
Yeah.
I'm not good with acronyms. I was not in the military. So
Yeah.
acronyms, I'm like, wait, what?
So First
Um,
Responders Veterinary Network is what it is, and you should be able to
nice.
Google it. We're starting to get some traction, but yeah, we're the only organization, outside of a few pockets that is doing this, and I think us being the facilitator for all these relationships with the vets and the volunteer fire departments and everything, it can only be positive if it's approached right. So I think we're not going to be able to get every call, but if we can develop it, I call this my retirement job because I'll probably do this for another 15 years. And it's something that I'm passionate about. It's something that took a lot of different skills from different parts of my past life to put together to pull this all together. But I think eventually we'll have enough folks, and it'll probably be in the thousands. Who knows? Tens of thousands. I can't imagine that. But it'd be good to have, and I think there's really no downside to it. All parties are getting a positive experience from it.
Absolutely. Well, we would love to have you on again another time,
Sure.
Doctor. I didn't realize you were a PhD. I'm like, crud, I should have called him Dr. Mack.
No,
So
I'm an MD PhD, so I'm both. They call me doc. They call it, the joke is around the hospitals is a doctor.
you're Doctor, right? You're all the doctors. That's like I right now have a number of customers that are on my service that both of the adults are PhDs.
Yeah.
So it's Doctor, the same thing. I'm like, okay, y'all.
Yeah, you can just call me
Too
Lee.
many
It's fine.
brains in the room.
You just call me Lee. It's fine.
But please do come
Yeah.
on again. And if you have
Yeah.
some sort of fundraiser or some way that the Your Family Dog podcast
Well,
can
we're
help
trying to do a
spread the
lift.
word.
We're trying to do a lift right now. I don't know when this airs, but we're trying to do, our first 30, 50,000. It's $2,000 for each pack and kit for each vet. So that's what we need the funding for. So if somebody wants to sponsor that, or, $20 a month, or, they're wanting to do a whole county, we'd love to sit down and talk with them and be able to do that for
Well, and I'll reach out to you off air about an organization that might be very interested in helping.
them. Okay.
So I'll see if I can connect you with them. So thank you so much for spending
Thank
your
you.
time with us today. And we'll see you next time on the Your Family Dog podcast.
That's it for today's episode. Thank you so much for spending part of your precious day with us. If you enjoyed the show, be sure to follow, rate, subscribe so that you never miss an episode. We'd love to hear from you. Connect with us on social media or email us at yourfamilydogpodcast@gmail.com. We'll see you soon.